Hi everyone and welcome to another episode. Thank you for showing your interest for our paper A overview episode. Now let's dive into the paper B. If you're preparing for the MRCPsych Paper B exam, you're exactly where you need to be. In this video, I'm going to walk you through a complete overview of our paper B online course and explain how it's designed to help you tackle this exam with confidence and clarity. Now, just a quick heads up like our last episode. This too won't be a short video and that's intentional. Paper B preparation comes with plenty of questions and I have made sure to address almost all of them right here. So stay with me till the end, grab a cup of coffee if you need to, and by the time we are done, you will have a very clear picture of how this course supports your preparation without the need for repeated follow-ups. Over the last 3 years, Medfortune Academy has been delivering well-structured, exam-focused preparation programs for MRCPsych candidates. We understand the challenges of Paper B, clinical application, judgment-based questions, and time pressure, and we have guided hundreds of trainees through this journey successfully so far. In this session, I will show you how our MRCPsych Paper B course is structured, how it helps you convert knowledge into exam-ready clinical reasoning, and most importantly, how it supports you in performing confidently on your exam day. So are you ready? I am Bastin and let's get started. Understanding the MRCPsych Paper B exam structure. Let's start by getting very clear about what Paper B actually looks like. Because understanding the structure of the exam is the first step towards planning your preparation intelligently. So what exactly is a MRCPsych Paper B? Unlike Paper A, which focuses on theory and basic sciences, Paper B tests your ability to apply knowledge to real-world clinical scenarios. This is where psychiatry starts to feel much more practical, decision-making, judgment, and clinical reasoning take center stage. In terms of exam logistics, Paper B also a 3-hour written examination, and you will be answering 150 questions in total, with 1 mark awarded per questions, giving you a maximum score of 150 marks. And just like Paper A, there are no negative marking, and that's an important advantage for you. It means you should never leave a question unanswered. If you are unsure, make an informed guess and move on. Now let's talk about the question format. Paper B also uses a combination of multiple choice questions and extended matching item question. But the key difference is this: the questions are far more scenario based and clinically focused than Paper A. You are not just recalling facts, but you are applying them to patients, presentations, investigations, and also managing decisions. If you are new to the MRCPsych exam style and want a clearer understanding of how these questions are framed, drop a comment below and we are happy to create a dedicated video explaining the Paper B question patterns in detail. What does the Paper B syllabus cover? Now let's move on to the most important part, what you are actually being tested on in Paper B. In Paper B, it covers the clinical components of the Royal College curriculum. This include organization and delivery of psychiatric services, general adult psychiatry, old age psychiatry, psychotherapy, child and adolescent psychiatry, and other clinical specialties that includes substance misuse and addictions, forensic psychiatry, learning disability, and finally, the notorious research methods, statistics, critical review, and evidence-based practice. If you look at the official Royal College syllabus, you will notice that these are the later chapters after building upon the scientific foundations tested in Paper A. In simple terms, Paper B asks how well can you use what you already know in clinical practice. Understanding the real structure of MRCPsych Paper B. MRCPsych Paper B is not an equal weight exam. It is a strategy-driven paper. Certain areas dominate this exam, while others contribute smaller but highly predictable marks. Knowing this distribution is the first step to scoring well. Organization and delivery of services, it's a system thinking, takes 5.5% of questions in the exam that carries 8 marks. This section assesses your understanding of how psychiatric services function, including multidisciplinary teams, leadership, quality improvement, and patient safety. Though small in size, it reflects a consultant-level mindset the exam expects. Second, general adult psychiatry, the core clinical domain. 20% of the questions in the exam that carries 30 marks are from this section. It forms a clinical foundation of Paper B. 1 in every 5 questions comes from this domain, covering major psychiatric disorders, management principles, and service level thinking. This section rewards candidates who understand guidelines, risk assessment, treatment planning, and real-world clinical decision-making rather than rote memorization. Third one, outdated psychiatry, high yield and often overlooked. 9% of questions in the exam that carries almost 14 marks are coming from this section. All-day psychiatry carries a significant and consistent presence in paper B. Topics like dementia, delirium, capacity, ethics, and physical psychiatric interface are commonly tested. Because the syllabus is focused and repetitive, this becomes a high return area for well-prepared candidates. Fourth one, psychotherapy. Foundational knowledge tested simply. 5.5% of questions in the exam that carries 8 marks are coming from this section. Psychotherapy questions usually focus on core models, indications, boundaries, and therapeutic principles rather than deep memory. A clear conceptual framework is sufficient to score well. Fifth, child and adolescent psychiatry. Conceptually testable. 9% of questions in the exam that carries almost 14 marks are coming from this section. Child and adolescent psychiatry contributes an equal share to all-day psychiatry. Questions frequently focus on developmental disorders, safeguarding, family systems, and psychopharmacology in children. Understanding concepts and principles with clinically focused preparation rather than excessive detail usually leads to strong performance here. Sixth one, the substance misuse. Small section but with clear patterns. 6.5% of questions in the exam that carries 10 marks are from here. Substance misuse appears in almost every diet, often with very predictable question styles. Intoxication, withdrawal, dependence, and management pathways are the key. With structured preparation, this is one of the easiest areas to secure marks. Seventh one is forensic psychiatry, where law meets psychiatry. 5.5% of questions that carries around 8 marks are from this section. Forensic psychiatry question test your understanding of the legal framework, risk, responsibility, and interface with the criminal justice system. Though the weightage is modest, the content is highly examinable and repetitive, making it a reliable scoring area. Eighth one, learning disability. Concept-based and scoring. It's purely concept-based. 5.5% of questions that carries almost 8 marks are from this section. Learning disability focus on assessment, comorbidities, capacity, safeguarding, and service provision. Questions are often straightforward and principle-driven. Well-prepared candidates rarely lose marks here. And the final, critical review, the backbone of paper B. 33.5% of questions that carries almost 50 marks are from this section. Critical review is the single most important component of paper B, contributing 1/3 of the entire paper. This section tests your ability to interpret research, understand study design, identify bias, analyze statistics, and apply evidence to clinical psychiatry. Students often underestimate this area, but in reality, strong performance here can compensate for weaknesses elsewhere. A systematic approach to research methods, statistics, and paper appraisal is essential, not optional. Exam strategy insight. If you look closely, over 70% of paper B comes from just 4 chapters: critical review, general psychiatry, all-day psychiatry, and child and adolescent psychiatry. This means smart prioritization, not equal study time, is the key to succeed. That said, the Royal College does introduce year-to-year variation. Some sittings may lean more towards one subspecialty than another. However, the overall pattern remains stable enough to guide smart preparation. The key takeaway here is this: paper B rewards balanced but prioritized revision. You cannot afford to ignore any section. But focusing extra effort on high-yield clinical areas significantly improves your chances of success. And this is exactly where a structured, exam-oriented paper B course makes a real difference, helping you allocate your time wisely, practice applied questions, and build confidence in clinical reasoning. Paper B, the real challenges. Now let's look into the struggles with RCPsych Paper B, an exam that many candidates describe as less predictable, more clinically nuanced, and mentally exhausting in a very different way. While Paper A tests your scientific foundations, Paper B tests how well you think, interpret, and apply psychiatry in real-world context. And that's where many candidates start to struggle too. Let's break down the real challenges faced by Paper B candidates. Challenge number 1, an extremely broad clinical syllabus with uneven personal exposure. Paper B spans multiple subspecialties: general adult, old age, CAMS, learning disability, forensic psychiatry, substance misuse, psychotherapy, and organization of services and all. Here is the real issue. Most candidates have not worked in all these areas equally. So, preparation often feels unbalanced. Topics you have never rotated through, like psychotherapy models, service delivery structures, or forensic pathways, feel abstract and difficult to contextualize. Candidates frequently ask, like, how much detail do they expect in areas I have never practiced in? Challenge number 2, heavy emphasis on critical review and statistics. For many candidates, critical review is the single most anxiety-provoking part of Paper B. Study designs, bias, confounders, statistical tests, interpretation of results, and abstract-based questions can feel really overwhelming, especially for those without recent research exposure. In recent years, especially after 2021, candidates have reported more complex interpretation-based questions from this chapter. Not just definitions. Knowing what a p-value isn't enough. You are expected to judge appropriateness, limitations, and clinical relevance under time pressure. Challenge number 3, psychotherapy concepts that feel vague and hard to anchor. Psychotherapy is another common pain point. Theories, models, therapeutic processes, mechanisms of change, and indications across different modalities are tested in subtle ways. Candidates often struggle because psychotherapy questions are rarely factual. Instead, they assess understanding of principles, boundaries, and therapeutic thinking, making it difficult to rely on memorization alone. Many candidates leave these questions feeling uncertain even after thorough study. Challenge number 4, increasingly nuanced and ambiguous clinical scenarios. One of the biggest changes noticed in recent years is a shift towards more nuanced clinical vignettes. Paper B questions often include incomplete information, competing diagnoses, or ethically complex situations. This leads to a common frustration. I could justify 2 answers. Candidates struggle not because they lack knowledge, but because the exam tests judgment, prioritization, and interpretation, rather than clear-cut facts. Challenge number 5, difficulty translating guidelines into the exam answers. Paper B expects familiarity with NICE guidance, service pathways, and risk management principles, but not always in a straightforward way. Candidates often find that real-life practice doesn't neatly match exam logic. Knowing the guideline isn't enough. You must identify what the exam considers the best next step in that specific context. This mismatch between clinical reality and exam expectations causes confusion and self-doubt. Challenge number 6, time pressure with longer, mentally demanding questions. Although some candidates may expect Paper B to feel easier than Paper A, many report the opposite. The questions are longer, require more reading, and demand sustained concentration for the entire duration of the examination. By the later part of the exam, mental fatigue sets in, especially during critical review and complex clinical stems. Managing pace while maintaining accuracy becomes a serious challenge, particularly for those who overthink about difficult questions. Challenge number 7, psychological pressure after previous attempts or long preparation periods. Finally, there is emotional side, often underestimated. Many candidates sit Paper B after already investing years into training and earlier exams. Previous failures, long preparation cycles, or repeated sittings can lead to performance anxiety and loss of confidence. In recent years, candidates increasingly report feeling burned out, isolated, and mentally drained, even when they know the content well. This psychological burden itself becomes a barrier to success. All these struggles are real. And importantly, they are shared by a large number of capable, hardworking candidates. Paper B is not just a test of knowledge, it's a test of clinical reasoning, judgment, exam strategy, and mental resilience. Struggling with Paper B does not mean you are weak clinically. It means the exam is designed to stretch candidates in a complex, sometimes uncomfortable ways. And that's exactly why a structured, exam-oriented, and informed approach is essential to clear it with confidence. Our solution: how we address the real challenges of Paper B. Now that we have understood where candidates genuinely struggle with MRCPsych Paper B, let's look at how our training framework is specifically designed to tackle these issues in a practical and exam-focused way. Rather than explaining this in theory, it makes more sense to walk you through our actual Paper B course structure so you can see exactly how the learning experience works. To begin with, let me introduce you our intuitive and easy to navigate learning platform. Accessing the learning platform. You can access all our courses by visiting our website at medfortuneacademy.com Once you head to the courses section, you will find multiple MRCPsych learning options available. For this walkthrough, I'll be demonstrating the Paper B bundle package, which is one of the most comprehensive and cost-effective offerings for candidates preparing for this exam. Once you enroll in the Paper B bundle, you will get full access to our dedicated Paper B learning ecosystem. Now, what's included in the Paper B bundle package? The Paper B bundle package consists of 3 core components, each carefully designed to address the exact challenges Paper B candidates face. First, the syllabus-aligned and clinically oriented study materials. The first component is our complete Paper B study materials, organized exactly in line with the latest RCPsych Paper B syllabus. All topics ranging from clinical psychiatry and subspecialties to psychotherapy, organizational services, and critical review are structured into clearly defined modules. Each section focuses on exam-relevant depth, helping you understand what matters, what doesn't, and how topics are tested in the exam. This approach removes common confusion around how much detail is required, especially in areas where candidates will lack direct clinical exposure. Second, targeted practice questions with real exam logic. The second component is our Paper B question bank, designed to reflect the thinking style of the real exam, not just factual recall. Each syllabus module is further broken down into focused subtopics, with dedicated MCQs and DMIs mapped precisely to those areas. These questions are written to test clinical judgment, interpretation, guideline application, psychotherapy principles, and clinical appraisal skills, mirroring the demands of recent Paper B exams. This allows you to actively apply what you have studied, identify weak areas early, and develop confidence in tackling complex and ambiguous clinical scenarios. Finally, the bundle includes full-length Paper B mock examinations created to simulate the actual MRCPsych exam environment as closely as possible. Everything from the number of questions and exam duration to question style, interface flow, and marking structure is designed to match the real Paper B exam. This helps you practice time management, maintain concentration during longer stems, and build exam day stamina, something many candidates struggle with in Paper B. Introducing the Pentametrics Learning Framework or PMLF. Now let's break down how our course material is unique and how our signature Pentametrics Learning Framework PMLF will guarantee your success in the Paper B examination. What is a Pentametrics Learning Framework? As I already mentioned in our previous episode of Paper A course overview, the PMLF or the Pentametrics Learning Framework is the first ever dedicated training strategy developed specifically for MRCPsych exams by Medfortune Academy. It's been prepared by our dedicated in-house team of psychiatrists and medical professionals with the particular viewpoint of succeeding in the MRCPsych exam by improving your efficiency in learning and increasing your accuracy in examination. What does this mean? Our entire course materials are prepared with 5 key components and their levels of understanding. Those are point-wise information delivery, clinical example exposure, comparison tables, expert tips on exam preparation, and practice questions with detailed explanations. Let me show you how PMLF help you succeed in your RCPsych exam. For this demonstration, let's take Chapter 6, Organization and Delivery of Psychiatric Services, to see how it works. As you know, each chapter in the RCPsych syllabus is quite long, so let's narrow down the focus to subchapter 6.1. When you log into our learning platform and open subchapter 6.1 titled The Nature and Process of Managing Psychiatric Cases, you can see how our study materials are designed for effective RCPsych exam preparation. As I mentioned before, each chapter is developed according to the Pentametrics Learning Framework. Component 1, the point-wise information delivery. The very first thing you will notice in our Paper B material is how clearly and logically everything is organized. Every single concept is mapped precisely to the latest Royal College syllabus. No gaps, no irrelevant extras, and absolutely no time-wasting content. Instead of overwhelming paragraphs, each topic is broken down point by point, making complex ideas easy to understand and even easier to remember. Take subchapter 6.1 as an example. Right from the first topic, you will see a smooth logical flow of contents. It starts with introduction to psychiatric case management, including definition and core concepts with key components. Then the biopsychosocial models in practice, then a detailed comparison table about it, followed by its clinical example. Everything you need is right up there. structured, concise, and exam ready. This point-wise approach makes learning far more efficient and significantly improves recall during the exam. Compare this with textbooks or traditional notes, where the same information is buried inside long paragraphs. You would have to read endlessly, identify what's important, and then create your own short notes, costing your valuable preparation time. With us, that work is already done for you. Let's look at the next session, multidisciplinary approaches in psychiatry. To understand about this further, this topic is carefully divided using clear subheadings and an easy to digest format. You start with a brief overview, move on to the core team members and roles comparison chart, then key competencies for multidisciplinary working, then benefits of multidisciplinary approach, then it comes a clinical example to reinforce understanding. So by the time you finish a topic in our material, you can be confident that you have covered everything thoroughly, logically, and efficiently. Now imagine tackling the same content through standard textbooks, long, dense paragraphs, endless reading, manual note making and all, and consistent second guessing about what's actually exam relevant. With our study material, you achieve the same depth and syllabus coverage in nearly 1/3 of the time, making your preparation smarter, faster, and far more effective. Component 2, clinical example exposure. The second core pillar of our Pentametrics learning framework is clinical example exposure. And this is where learning truly comes alive. For every single topic in the RCPsych syllabus, we provide carefully designed clinical examples. And yes, we genuinely mean every topic. These are not generic cases, but realistic UK-focused clinical scenarios, aligned closely with how psychiatry is practiced and tested in the MRCPsych examinations. Why does this matter so much? Because instead of learning concepts in isolation, each theoretical idea is immediately translated into a real-life clinical situation. This approach offers multiple powerful benefits. Mainly, concepts register far more easily in your memory, then learning becomes more engaging and less passive. Also, you become confident in tackling exam questions framed as clinical scenarios. And finally, this foundation helps you immensely not just for paper B, but significantly for the CAS examination as well. Let's see how this is applied in our study material. In subchapter 6.1, Managing Psychiatric Cases, under the basic definitions and core concepts, when you scroll beyond, you will find a clinical example which discusses about the situation of a 35-year-old patient with depression. You can see the biological, psychological, and social domains of that situation revealed in that patient's context. This case directly reinforces your understanding of the biopsychosocial models discussed in the above sections. Similarly, in the second topic on multidisciplinary approaches in psychiatry, the first relevant clinical example appears immediately after the key competencies and the comparison of core team members and roles. This example explores the first episode psychosis situation of a patient and how the core members acting upon and their respective roles, which helping you connect theoretical concepts with real clinical situations. Further down in the subchapter, under the topic of special role of the psychiatrist, after covering the medical leadership and expertise, coordination of treatment processes, and decision-making framework, you will find another targeted clinical example. This one discusses how a psychiatrist could manage a treatment-resistant depression case under different responsibilities. You can see the tasks taken care of under assessment, coordination, decision-making, and monitoring. It reinforces developmental concepts at a deeper and more meaningful level. Altogether, our Paper B study material includes more than 2,650 carefully integrated clinical examples designed to transform abstract theory into practical understanding, making your learning not only effective but genuinely engaging. Component 3, Comparison Tables. Comparison tables form one of the most powerful pillars of our Pentametrics learning framework, and for good reason. In the MRCPsych exam, success isn't just about knowing a concept. It's about clearly distinguishing one concept from another and understanding how their clinical implications differ. This is exactly where many candidates struggle, especially when MCQs present closely related or deceptively similar answer options. True clarity in a MRCPsych syllabus emerges only when concepts are directly compared side by side. That's a gap our comparison tables are designed to fill. Throughout our study material, you will find comparison tables integrated into every topic and concept. These tables systematically highlight key differences, helping you move beyond surface level understanding. For example, from this chapter, we are giving you the demonstration. For the first topic of Introduction to Psychiatric Case Management, you will find our first comparison table that clearly contrasts the different domains of biopsychosocial models in practice. Instead of wading through long paragraph-style explanations, the table format allows you to instantly differentiate between concepts, deepen your understanding, and sharpen your ability to answer complex exam questions accurately. Similarly, in the next topic, multidisciplinary approaches in psychiatry, you will see a dedicated table clearly comparing the core team members and their roles in psychiatry. When you move further, you will find your next comparison table, which provides clear-cut details about major classes of psychotropic medications with their relative mechanism, indications, and examples. These comparisons are structured effectively, making it much easier to grasp more details by comparing each other and register to your mind more easily. In total, our Paper B study material includes more than 1,100 carefully designed comparison tables, all aimed at making your learning faster, clearer, and far more exam efficient than conventional study methods. Component number 4, Expert Tips on Exam Preparation. This is the most exam-focused pillar of our Pentametrics learning framework (PMLF). Rather than limiting ourselves to delivering high-quality study material alone, we go a step further by providing expert guidance on how to prepare each topic and chapter specifically for the MRCPsych Paper B examination so that your effort translates into maximum exam output. Here is how this works in practice. At the end of every chapter, including the subchapter 6.1, you will find a dedicated section titled MRCPsych Paper B Exam Relevance. This section is designed by bridging the gap between your learning and exam performance. The first part clearly explains how important this particular subchapter is for the Paper B exam. As you may already know, the structure and questioning style of the RCPsych examinations have evolved significantly over the past 7 to 8 years. Our academic team closely analyzes these changes and updates the section annually based on the latest exam trends. The second part focuses on frequently tested themes from previous Paper B examinations. Here, you will see exactly what aspects of the chapter have been repeatedly asked over the last 7 to 8 years, allowing you to assess whether your level of preparation truly aligns with real exam demands. Beyond this, we have included expert-curated exam success tips for every chapter. These insights are developed through consultation with multiple subject experts, inputs from experienced academicians in psychiatry, also proven strategies shared by our successful candidates who have recently cleared the RCPsych exams. By following these targeted tips, you can fine-tune your preparation and approach Paper B with greater clarity and confidence. To support efficient learning, we also provide memory aids such as mnemonics, helping you memorize key concepts in the correct order with ease. Then it is also provided the common exam pitfalls and traps to avoid succeeding in your RCPsych journey. Finally, each chapter concludes with a concise, high-yield summary highlighting all the essential points as well. This allows you to quickly check whether you have covered everything important, perform rapid revision, use it as an effective last-minute refresher just before the exam. Together, this component ensures that your preparation is not just thorough but strategic, exam-aligned, and results-driven. Component 5, Practice Questions and Explanations. The fifth key pillar of our learning framework focuses on what ultimately decides your exam performance, the practice questions. With every chapter of the MRCPsych Paper B syllabus, you will receive real exam-style practice questions designed to closely reflect the format, difficulty level, and evolving trends of the actual RCPsych examination. These questions are included as part of our bundle package, and they are also available as a standalone subscription if you prefer to practice them separately. Each set of practice questions are carefully crafted in line with the latest exam patterns and ensures complete coverage of the high-yield areas within that chapter. Beyond simply familiarizing with questions format, these questions play a critical role in reinforcing and consolidating your learning. Here is what makes them especially effective. Every practice question comes with the correct answer, a clear, detailed explanation of why that option is chosen as a correct one, also an explanation of why the remaining options are incorrect, specifically in the context of that particular question. So this approach allows you to learn not only from the right answer, but also from the distractors, helping you avoid common traps in the actual exam. In addition, each question set includes expert tips on how to approach similar questions in the Paper B examination, making your practice more targeted and exam-oriented rather than generic. Let's look at another question as an example. First, a question: then the options, then the correct answer, then the reason for that answer to be correct, then the reason for the wrong options and why they are distractors in this question point of view. Then finally, an expert advice about how to prepare for similar questions from this chapter for RCPsych Paper B exam. In total, our Paper B course provides more than 4,500 high-yield practice questions, ensuring that you are thoroughly prepared, confident, and exam ready by the time when you sit the examination. The PML framework, a truly complete learning experience. So, what actually happens when you complete a chapter using our Pentametrics learning framework? Simply put, you have covered that part of the MRCPsych Paper B syllabus in the most thorough, structured, and exam-ready way possible. Let's break down what you have truly achieved by the end of every single chapter. First, you have mastered the core concepts presented in a clear, structured, and in-depth format. You have bridged theory and practice through realistic UK-focused clinical examples. You have built the ability to differentiate between closely related concepts using high-yield comparison tables, and you have gained valuable exam insights and expert preparation strategies aligned with current Paper B trends. And finally, you have tested and reinforced your understanding through exam-style practice questions with detailed explanation that goes far beyond routine study. This is a strategic, exam-oriented preparation designed specifically for MRCPsych success. Every single chapter of the RCPsych Paper B syllabus in our course is built using this exact framework. The Pentametrics learning framework was created with one clear objective: to equip you with the confidence, clarity, and competence needed to face a Paper B exam with the highest possible chance of success. Why our Paper B course truly stands apart? Now let me explain why we are so confident about our MRCPsych Paper B course. Fully comprehensive, nothing left behind. The first and most important reason is very simple. This course is fully comprehensive. It offers complete and in-depth coverage of the entire RCPsych Paper B syllabus. Whether you are revising high-yield topics or strengthening areas that are tested less frequently, our material ensures that nothing is overlooked. Our aim is clear: to prepare you thoroughly enough to clear Paper B confidently on your very first attempt. And here is our promise to you: you don't need any additional textbooks or external resources for your preparation. No other online platforms, no offline notes, no last-minute searching, nothing. Everything you need for Paper B is included right here. What do you get with this course? Let's break it down clearly. Point-wise study materials, no unnecessary content, no distractions, just exactly what you need for the exam. All content is expertly developed and reviewed by UK qualified psychiatrists and higher trainees with extensive experience in MRCPsych teaching and examinations. You are learning from professionals who understand the exam inside out and know what truly works. 10 months of full access, giving you ample time to prepare thoroughly, revise effectively, and study at your own pace. The numbers that truly speaks for themselves. This is where our course genuinely sets itself apart. 1,100 plus comparison tables that simplify complex and closely related concepts through clear side-by-side explanations. This is crucial for distinguishing between those tricky, similar-looking MCQ questions. Plus, 2,650 plus UK-focused clinical examples, carefully contextualized within real NHS-style scenarios. This makes learning realistic, memorable, and extremely helpful for CAS preparation as well. 1,200 plus clinical relevance notes that highlight the real-world application of theoretical concepts, bridging the gap between textbook knowledge and clinical reasoning. For visual learners, 650 plus illustrations to enhance conceptual clarity and retention, 220 plus flowcharts that breaks down clinical processes and protocols step by step. And finally, 4,500 plus high-yield practice questions with detailed explanations designed to reflect real exam patterns and sharpen applied understanding. All content is delivered in a concise, point-wise format, making it perfectly suited for objective-style MRCPsych Paper B questions. Study anywhere, anytime, on your terms. The course is hosted on a fully interactive online platform, accessible anytime and from anywhere, whether you are using a desktop, laptop, tablets, or smartphone. The platform is intuitive, responsive, and built for uninterrupted learning. On your free time, on a tea break, or even traveling to work, you can study whenever and wherever it suits you. Always current with weekly updates. The MRCPsych exam evolves, and so does our course as well. To keep you aligned with the latest exam trends, the platform provides weekly updates including new questions, content revisions, and new mock tests. This ensures that you are always studying current, relevant, and exam-aligned material, not outdated content. More than a course, a complete preparation ecosystem. Let me be very clear, this is not just a collection of notes. It is a complete preparation ecosystem, purpose-built for MRCPsych Paper B success, just like our Paper A course, with structured, evidence-based, and exam-focused content. Our course is designed to help you more closer to your goal of becoming a member of the Royal College of Psychiatrists with confidence, clarity, and competence. This is your pathway to success. Everything you need, all in one place, designed by experts who truly understand your journey. Try before you commit. Experience our free trial courses. Now, you might be thinking, okay, it sounds great, but can I try it free before purchase? That's exactly why we have created our free trial courses. Start your MRCPsych journey risk-free. You can begin your MRCPsych Paper B preparation with zero risk through our free trial courses. It's carefully designed to help you evaluate the structure, depth, and overall quality of our learning resources before you commit to the full program. You can enroll today and upgrade whenever you feel ready. And to make it even easier, check the video description below. The link to the free trial course is right there waiting for you. What's included in the free trial? Our trial course gives you full access to 4 complete chapters from our comprehensive Paper B study material, including managing psychiatric cases, emergency psychiatry, relationship between crime and mental disorder, and basic health economics. These chapters are presented exactly as they appear in our full course. No cut down content and no compromises. You experience our structured, exam-focused approach exactly as our full course students do. Start learning today. See for yourself what truly sets Medfortune Academy apart. This is your opportunity to experience high-quality, exam-oriented MRCPsych preparation before making any commitment. No credit card required, no hidden conditions, just quality education ready for you to explore. Take your first confident step towards MRCPsych success. Start with our free trial today. Flexible purchase options for MRCPsych Paper B. When you visit our Medfortune Academy website, courses page, you will find 3 flexible purchase options for MRCPsych Paper B, carefully designed to suit different learning styles, preparation strategies, and budgets. Option 1, the bundle package. It's our top recommendation. This package brings together comprehensive study materials, high-yield practice questions, and full-length mock exams, all in one complete integrated preparation solution. And the best part, it's offered at a significantly affordable price compared to purchasing each component separately. Think of it as your all-in-one exam success toolkit. Everything you need working together in the right sequence. Option 2 and 3, individual components. If you prefer a more customized approach, you also have the option to purchase study materials separately and practice questions separately. This flexibility allows you to tailor your preparation based on your existing resources or study preferences. Why we strongly recommend the bundle package? Here is why the bundle package remains our top recommendation. It is fully powered by our Pentametrics learning framework and provides everything you need for MRCPsych Paper B within a single structured ecosystem. You experience a complete learning journey, learn concepts through comprehensive point-wise study materials, apply those concepts using targeted exam-style practice questions, test yourself with full-length mock exams that simulates a real Paper B experience. This isn't about having more resources. It's about having the right resources in the right order. So your confidence and competence build step by step. And yes, you also save a lot of money while getting the most complete preparation possible. It's a smart choice for serious candidates aiming to clear Paper B on their first attempt. Let's comment. We are here to support you. Let me be honest, preparing for MRCPsych can really feel overwhelming at times. And it's completely normal to have questions along the way. That's exactly why we are here. If you have any questions, whether it's about our courses, your study plan, or any aspect of MRCPsych preparation, you're always welcome to reach out to us via email or WhatsApp. Our team is genuinely committed to supporting you throughout your preparation journey. And if there is any topic you would like us to cover in our future YouTube videos, please leave a comment below and we will bring it up for you. Your feedback truly helps us to support you better. Final thoughts. Your success is our mission. So that brings us to the end of this comprehensive overview of our MRCPsych Paper B course and the Pentametrics learning framework. Thank you for staying with me through this detailed session. I know it was quite long, but I hope you now have a clear picture of how we can support you at every stage of your exam preparation. I genuinely wish you all the very best and every success in your RCPsych exams. Psychiatry is a challenging yet deeply rewarding path, and with the right preparation, structure, and support, you absolutely can achieve your goal of becoming a member of the Royal College of Psychiatrists. Remember, success doesn't happen by accident. It's built through structured preparation, consistent effort, and the right resources. Stay focused, keep moving forward, and I'll see you in the next video. Don't forget to check the video description for your free trial course links. Start your journey today. Thank you.